How many of you have seen a blood clot during your period? You know, those like little jello looking, like dark red blobs, and they like have a form. Like it's not like water that goes through your fingers. Like you can hold it, and like if you pinch it, it'll smush kind of like jello. That's like a blood clot. Hey, I'm your local OBGYN. I love women, and let's talk about it. So, not everybody has a blood clot. And if you haven't asked your girlfriends or your family, this may be mind blowing to you that like not everybody will pass blood clots with their cycles. But there are certain like groups that are going to be more at risk for this. The reason it happens is that our blood is actually meant to clot. It's a normal function of bleeding, so that when you have bleeding of any sort, okay, the body tries to sort of like heal itself. It tries to slow the bleeding down by creating a clot that will hopefully kind of like push against some of the bleeding and then stop the process. Now, blood clots in the vajayjay, what happens is your menstrual lining sheds, and if you tend to have heavier cycles, it comes out a little faster, and the blood just doesn't just go from uterus out. It like takes a second. Like it can sit in the uterus or in the vagina for a little bit until you get up and move. You'll see it maybe more so when you wake up in the morning and you get moving, and then the gravity kind of takes over and lets these things slide out. So that blood that sits there for a little bit, especially when it's heavier, can actually form those jello balls. Again, some small, some big. I've seen all sizes. So you will see this more commonly, that women will have blood clots if they have adenomyosis, heavy menstrual bleeding, sometimes with other bleeding disorders, fibroids. If a teen gets a blood clot, it's actually a much higher chance that they do have a bleeding disorder, that you might want to get worked up so they don't have persistently terrible cycles.